Welcome everyone. Again, thank you for joining today's session on publishing standard charges, how hospitals can take charge of the price message. So let's take a look at our objective over the next hour. As I'm sure all of you are well aware by now, CMS is requiring all hospitals to post their standard charge master in a machine-readable format. So we want you to walk away today with a tangible strategy that you can take back to your leadership with recommendations for how to do this. And the key word here is strategy. Some hospitals will simply just post their charge master to check that box and meet the mandate. But as we will discuss over the next hour, doing just that potentially presents a huge problem in the eyes of your patients. So before we get started, we're going to go ahead and launch a poll question here. And our first poll question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? And the options here are very confident, somewhat confident, or not confident. And again, that question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? Very confident, somewhat confident, or not confident. And we'll give everybody about 30 seconds to get their votes in. All right, thank you everybody for voting, and we'll be distributing those poll results after the session. So just some brief introductions before we get started. My name is Brad Josephson. I'm the Director of Marketing here at PMMC. Also with me today is Greg Kay, Senior Vice President at PMMC. Greg's been in healthcare for 30 years and advises many of our clients across the country on price transparency strategies. And Greg's going to go ahead and kick off today's session with the latest from CMS.
Good afternoon, everyone. Thanks, Brad. As you're probably aware of the pricing transparency rule that goes into effect on January 1st, 2019. But did you know CMS has also released a frequently asked question document, or FAQ, pertaining to the rule? We're going to be covering these today along with suggestions on how you should respond and how to get ahead of the pricing transparency issue. Now, CMS's rule states that all hospitals will be required to publish their standard list of prices online in a machine-readable format, and they must update this list of prices at least annually. The statement is somewhat generic, and it did leave many with unanswered questions. But Secretary Azar's statement that has been published was very clear, and we can see that CMS is really looking to move or prompt our industry to a new era where patients will have increased information, specifically related to quality and pricing, to make well-informed decisions. These are purchasing decisions. Their goal, being CMS's goal, is to drive competition. Now, one of the questions in the FAQ document released by CMS related to the format of the publication, being your CDM file. CMS states the format is to be the hospital's choice as long as the information represents the hospital's current standard charges as reflected in the charge master. Now, CMS also makes it clear in the FAQ that the requirement to post charges applies to all items and services provided by the hospital. CMS also went on further to define machine readable. It has been defined as the format as a digitally accessible document that can be easily imported or read into a computer, such as Excel or a CSV file. It specifically stated that a PDF document would not be acceptable. CMS also addressed a number of hospitals' questions around the question of if they were already participating in a state online transparency initiative, how did that impact this federal requirement? CMS clarified that a state program does not exempt a hospital from the federal requirement. You actually will need to do both. The last FAQ, the last Q&A in the FAQ that we're covering relates to the question of do the requirements restrict a hospital from posting quality information or additional pricing information? And the response was no. CMS actually encourages all hospitals to undertake efforts to engage in consumer-friendly communications of your charges to help patients better understand what their financial liability may be for a service that they obtain at your hospital, and to enable patients to compare charges for similar services across hospitals. In other words, providing comparative market and quality data. Next, I'm going to turn the presentation over to Brad to give you a little bit more insight on what else CMS is up to that you may or may not be aware of.
Thanks, Greg. And that last question I think is really telling, and here's why. In addition to the FAQs, we've learned some more intel which may not yet be widely known. CMS has released what they are calling a source sought notice, which really doesn't sound like much on the surface. But if you read into it, you will see that they are seeking vendors for a, quote, web-based platform to support healthcare pricing comparison and bidding activity. This, combined with the CMS administrator's comments about price shopping, leads us to believe that CMS is plotting a move towards a retail-like model that allows patients to shop for healthcare services. We could be talking about the Cars.com for healthcare. It's not hard to connect the dots here. While the only named requirement so far is publishing standard charges online, this really appears to be the first step or just the tip of the iceberg in CMS's long-term intentions for pushing price transparency. So how are hospitals feeling about all of this? I'd like to share some survey results from our last webinar that we did on this topic with HBI, which surveyed 150 healthcare participants across the country. If you're concerned about this, you're not alone. In fact, 92% of healthcare providers said that they are either somewhat or very concerned about how their charges will be perceived by the public. Now, the public can mean a variety of things. It can mean your patients, but it can also mean the local media, which I think is a piece that might be getting overlooked in this whole rule. Keep in mind, the media has never really had access to this type of ChargeMaster data in the past. So I can almost guarantee that once these charges are published online, the local media will be all over this. We also found out that 43% of healthcare providers don't know yet how they will address the mandate, and we'll hopefully give you some strategies that you can take back to your organization today to help address it. And a little bit concerning here, and we'll dive into this a little bit more as well, is that only 29% said that they were planning to post additional pricing information along with the standard ChargeMaster file. And we're going to talk about why that's so important here over the next hour. So why is additional pricing information so important? And why is a pricing strategy needed? Well, here's what we know. 36% of healthcare consumers have shopped either online or via a mobile app within the last year. This is according to the most recent United Healthcare Consumer Sentiment Survey. And that number is only going to grow because half of the 72 million people in the millennial generation is now price shopping for healthcare. The second point, which we already know, is because CMS is demanding it. 100% of the hospitals in the United States will have to post 100% of their charges. The final stat, which may be a little bit surprising, is from a recent Black Book survey that said 90% of patients said that they do not feel obligated to stay with a healthcare provider who does not deliver a satisfactory digital experience. So that's very telling in that if consumers aren't getting what they need quickly in a digital format, they have no problem leaving and going to a different healthcare provider. So the big takeaway from all of this is that without his pricing strategy, consumers are going to vote with their wallet, which means they could switch healthcare providers. So this now begs the question, what do you do as a healthcare provider to meet all these demands? We believe there are 3 different options, and we'll explore each one. Option 1 is to simply export your CDM into a machine-readable format, such as Excel, and post it on your website. This is mandatory. You have to do this no matter what at this point. And you can do this yourself, internally, and just check that box, so to speak. But remember from that last FAQ that CMS pointed out in the new healthcare price transparency rules that they do not restrict a hospital from posting quality information or additional price transparency information. In fact, as Greg mentioned, the federal agency encourages hospitals to provide consumer-friendly communication regarding hospital charges. So this brings us to option 2 and 3. Option 2 would be to post your full CDM along with comparative market charges. We know that charges on their own really mean nothing to the patient. So if you post this information on your website, you can control the content and the ability for a consumer to view MRI charges, for example, aligned with charges at other local hospitals, which may prevent inaccurate price comparisons. This at least helps you to start controlling the price message. The third option, and this is the one that we believe is the ideal option, is to post your full CDM and also provide patient estimates. As we know, the patient portion versus the retail charge are often 2 very different numbers. An accurate estimate on your website that reflects the patient responsibility after the contractual discount and deductible will likely be much lower and is the number that provides actual value to patients. So January 1st, 2019 is the deadline to publish a list of standard prices in a machine-readable format. There's no getting around that. But there are things you can start doing today to get ahead of pricing transparency. First, you should know how your commodity pricing compares to the market. For items that are often price shopped, will you be the high-cost provider? This is really, really important to know. Then, before posting your CDM, it's important to consolidate your charge master into a single file that is machine readable that also factors in pharmacy and supply items. You may not have time to change your prices before January 1st, or you might think you can only change prices once per year based on payer contract language. The price transparency rule states you should update this information at least annually or more often as appropriate. So this means if you lower your charges after January 1st, you can push out those updates at any time. For hospitals who do not want to submit price changes to payers, a revenue-neutral charge master adjustment is certainly an option and can help organizations focus on improving commodity pricing without a revenue impact. Taking control of the pricing message and allowing patients to determine their out-of-pocket costs through your hospital's website may not be a realistic goal for January 1st, but it can be a goal you can start working towards right away. So I've outlined some ways to get ahead of pricing transparency, but Greg is going to discuss these strategies in a little bit more detail and also address some other trends we're seeing in the market.
Thanks, Brad. Yes, it's clear that CMS and consumers are pushing for greater pricing transparency. One of the key questions is, where do payers fit in to this move towards pricing transparency? Well, as many of you know, hospitals have not been extremely successful in negotiating with their payers to keep reimbursement neutral and lower charges at the same time. I think we all recognize that pricing transparency is often a buzzword for lowering charges. And as we lower charges, it can have a direct impact on the discount that you have with your payers. In fact, in the past month, I've heard of 2 scenarios where payers are entering into a negotiating situation with a hospital and letting them know up front that they were having trouble promoting their organization because the discounts they were previously providing to the employers were not as great as they previously were. So a hospital that has adjusted or lower charges to, let's say, a 45% discount now, the payer and the market, being employers, may have grown accustomed to a 65% discount to, again, give the employer groups the perception that there is a greater discount that's going on. As you can imagine, if payers are pushing this onto the hospital will need to increase charges to protect their revenue. This is counterintuitive to pricing transparency, but it makes sense in isolation. As hospitals need to move away from large discounts based upon our current model of price setting or charge setting and discount or payer negotiation, the question then comes up, what's the real value to the payer? It will be interesting to see how payers deal with pricing transparency over the next year, 2, 3, as we go forward. But in the meantime, be aware that this type of message from payers may also undermine your pricing transparency strategy. It's also further proof that while charges are the focus today, hospitals need to keep patient estimates that reflect the true cost of what the patient has to pay in the forefront. You will need to look at, as we go forward in time, that integration of your retail price and your discount price or negotiating strategy together. And that integration means not only operationally and process, but the same platform as you're adjusting charges and adjusting your negotiated rates. Now let's take a quick break for another question.
Thanks, Greg. And we do have some questions coming in from the audience. And I do want to point out, if you do think of any questions throughout the presentation, we have 3 Q&A breaks scheduled. So go ahead and type in a question into that questions tab in your GoToWebinar pane, and we will take it as they come in. So one question that we have here, Greg, and maybe you can speak to this, has CMS announced any further rules beyond the January 1st mandate?
Yeah, good question. Not to our knowledge at this particular point, but CMS has made it very clear that they want more pricing transparency for patients, or as we have to get used to, consumers. So we wouldn't be surprised to see more mandates along these lines in the future. Hospitals should consider this to be the first step of many, which is why it's so important to get ahead of this with a pricing strategy, not just the tactical step of posting your charges.
Yeah, that all makes sense, Greg. Next question that we have, When CMS cites all charges, does this require professional prices?
No, this time we understand the focus is on posting the technical charges or the hospital charges. CMS has not referenced professional prices at this particular point in time.
Okay. And then one more question for this break, and I think this is a good one. What are the most important things that my hospital should do before January 1st?
So there are probably two really important things you should do now. The first is to make sure you have a consolidated CDM file to make sure that everything from pharmacy to supply charges are standardized and available in the document. The second step would be to conduct a comparative market analysis to really understand how your charges compare to your local market or your competition. Ideally, you should publish comparative charge information to at least give your patients an idea of how you compare. If you're not going to publish that information, you should at least know where you stand in the marketplace.
Thanks, Greg. And with that, we're going to go ahead and launch our second poll question. So this question, what is your level of concern about how your standard charges will be perceived by the public? And the options here are very concerned, somewhat concerned, or not concerned. Again, that question is, what is your level of concern about how your charges will be perceived by the public? And those options, very concerned, somewhat concerned, or not concerned. And we'll give everybody about 30 seconds here to get their votes in. All right, thank you everyone for voting, and we are going to keep moving on with the presentation.
Great, thanks, Brad. We do appreciate the questions, and feel free to continue to incorporate those as we go along. And we'll cover the next questions on the next break. I see we've got a couple more out there. So the pricing transparency rule that's out there today really addresses charges. It's kind of interesting that we refer to it as a pricing transparency rule when in fact the current rule is a charge transparency rule. We should be thinking about this in terms of prices, and this may drive customers because we are focusing in on charges to look at something that is really not a relevant point if taken at face value. So here are three words that are so simple, but yet so confusing because they have completely different meanings for payers, providers, and consumers. Let's break down charges versus pricing. CMS requires hospitals to begin publishing charges. As we know, this really isn't helpful for patients or consumers to know what will actually cost them. Most patients don't understand that retail charges are almost never paid. They also do not understand that the relationship among hospitals and payers being the discounted rate or the contractual rate, and individuals can't make the connection that charges are priced high so that payers actually receive the discount that we were referring to a moment ago. So as we go forward and as you start thinking about pricing transparency, not just from a tactical standpoint, but from a strategic standpoint, please keep in mind we're needing to move towards an industry that is addressing a digital patient-centric approach. And we've got to ensure that our charges or retail price is published, it is transparent, but at the end of the day, it's going to come down to what is this costing the individual, being their out-of-pocket expense for a particular service before the service is actually provided. So let's look at a real example, that being a CAT scan of the abdomen and how a comparison of charges played out. This example is from an NPR story that was done last year. And it highlights the conflicting material that can be found on the web or through phone calls into providers. And this type of conflicting information can be very confusing for patients and may misrepresent a hospital or a provider. Based on charges, the medical center in this example looked to be over 30 times the price of an imaging system or center. This could be your organization. You have an opportunity to change the narrative so that the actual price is not as significant when we take into account the patient's actual insurance allowable, being the negotiated discount rate, the co-insurance, and the copay for the individual patient. In this particular example, we can see that the imaging center had a higher charge, obviously, than $286. But when we factored in that allowable, the patient co-insurance, and the copay amount, the patient responsibility, their cost was $286. When we looked at Gulf Coast Medical Center, and we take into account a very large contractual discount, which brings the allowed amount down to $1,650, and we apply the same 20% co-insurance and the $50 copay, we can see that real price difference is really only $380. The key is, as we go forward, we need to be looking to change that price narrative and really meet patients online as they're researching and shopping, because the price difference probably is not going to be as great as what this initial story would have led a patient to believe. On the timeline we reviewed in the prior slide, we discussed the importance of knowing how your prices compare. This is something you can do prior to January 1st. With consumerism on the rise, you need to know what procedures or items you're getting calls or complaints about, what items are price shopped most frequently, who you're competing with, whether that be other hospitals, freestanding centers such as lab or radiology clinics, AmSurg clinics, and lastly, procedures or services where you might be losing volume due to your charge differences. Again, these are key questions that you should be raising internally and setting up metrics to track on a very routine basis. Now, in this particular slide, it's an example of how you can start to use data from CMS, sometimes referred to as MedPAR data. More frequently today, organizations are using the CMS standard analytic file. And this data has been used internally by hospitals for years to compare hospital charges. At the point we're at now, we should be rethinking how we want to use or repurpose this data to educate patients on charges at your hospital versus others, being how you want to compare your charges in the marketplace. This next slide shows charges at a particular hospital compared to other local hospitals and the state average to better educate patients, showing your CDM charges at more of a detailed line level. This particular example is using radiology services. The price shopping ideally should stop at your website. We want patients to go to your local hospital website and use that as the primary resource. If we can give patients what they want in your local community, we're able to control that price message. With CMS data, you can post heavily price shopped items such as MRIs and eliminate the need for patients to link data from various sources or risk an apples to orange comparison. Again, it's important for you to think through from a strategic standpoint how you want to provide relevant information to patients as they begin shopping more and more frequently for services. If you don't feel good about your charges, keep in mind you can always change them. You don't have to wait until your next fiscal year, and many hospitals are beginning to look at and change prices, but doing it in a way without impacting net revenue. The key is identifying and prioritizing your goals related to market price, your cost information, gross and net revenue, and also understanding your patient mix and reimbursement to know how to best reach the end goal. Again, that being a correctly priced CDM that balances with payers looking for discounts and consumers looking for the most relevant price or charge information. Now, a quick example, we recently worked with Catholic Medical Center to help them balance their goals through a CDM or strategic price rate adjustment project. This organization knows their commodity prices and how they looked in the market. With that being said, they were well prepared for the January 1st mandate. They are actively working with their state association in New Hampshire to really standardize what they're posting online. This particular organization has been very confident that they'll meet the requirement beginning January 1st, and they wanted to be very clear and very concise to make sure patients are getting all the information they need, but the same concise message. One area that they're going to work on improving is their website. So while they know their price information is clear, they want to make sure that they're conveying that information to patients in more of an educational way. They want to look at patients being able to request an estimate online by just entering their insurance information. The analogy that they were using was, it's like putting your house on the market. You have to get it cleaned up and ready to go before you actually show it to the public. That's where their strategic pricing process came into play. Now, for this particular client, we looked at all services, including physician practices, supplies, pharmacy, and hospital charges. Catholic Medical Center had 3 clear stated goals. They wanted to continue to be the low-cost, high-quality healthcare provider in New Hampshire. They wanted to stay just below the market, and they consider that to be at about 95% of the market average. And they were able to analyze market data to map out a pricing scenario that allowed them to ensure their charges were at that level within their marketplace. And lastly, their goal was to stay net revenue neutral. This required them to be very strategic about lowering and raising charges at just the right place. Now, the hospital also collaborated with their pharmacy department with a goal of moving away from average wholesale pricing towards a markup and formula based off of cost. This organization worked through different pricing scenarios that allowed them to meet those three goals, one of which was to remain net revenue neutral as they went through a fairly elaborate process of adjusting their pharmacy charges. They got internal feedback from their CFO and budgeting departments before choosing the best scenario. And one of the key factors to their success was comparing volumes to the previous year by CPT code to really see and understand what their highest price services were. They also looked at what services were price shopped most often by patients, in other words, the commodity priced items. And they also took into account where services were that patients complained about pricing the most. Again, all of this analysis allowed Catholic Medical Center to determine areas that they could lower prices but still remain net revenue neutral as they adjusted to be more in line with the market, as they knew they were going to have to post charges and make charges more readily available to the public. So let's take a break here for a few additional questions.
Sounds good, Greg. And I'm going to pull up our questions tab to see if we've gotten any more here from the audience.
Okay, so the first question is, how do Epic hospitals post all charges when Epic has pharmacy and supplies as shell records in the CDM? Great question. It is definitely something that we see hospitals needing to pull out that detailed pharmacy and supply cost information to come up with your charge or your price for those pharmacy and supply items. CMS was very clear that they are expecting organizations to post all CDM list price items. So we would look for organizations to pull that information out. You're probably going to have to do some analysis outside of your CDM to come up with that list price of services that would and should include both pharmacy and supplies. It looks like the next question is very similar to the prior one. How do you recommend we handle supply and pharmacy charges that are based upon cost, in parentheses, formulary, that can change often? Again, as CMS noted in the FAQ, you can update your prices more frequently than annually. The only requirement is that you do need to update your list of prices on an annual basis. Obviously, as your cost changes, you have the flexibility to update what you're posting to your website, but you are going to be required to post all charges, both your procedure charges, your time charges, your supply pharmacy charges, and for those items that are based upon a cost, you're going to have to review and come up with a methodology that will be both explainable and defendable with what cost you're going to be using in terms of running that through your formulary to be able to list your price for those items.
Thanks, Greg. And I do have one more question here that I think was referencing one of the graphs you looked at. Where can you find the information that was on the CMS side-by-side comparison slide?
Yeah, great question. That information is from CMS's standard analytic file. This is something that CMS publishes on a quarterly basis. Whoever you have worked with from a strategic pricing standpoint in the past should be able to provide you with that information. That's also something that PMMC actually purchases from CMS, and that's where we pull that particular data. It is publicly available data, so you do get to charge from any hospital or statewide average. If you would like to see that information from your organization, feel free to reach out to either Brad or I. We would be glad to set up a call and provide that information to you as well.
Sounds good. Thanks, Craig. And we're going to keep going forward with the presentation. We do have one more Q&A break at the end. So if you think of any questions, feel free to enter those, and we'll take them at the end of the presentation. And we are going to launch one final poll question here. And that final poll question is, how are you planning to address the new CMS price transparency mandate by January 1st? And those options are post standard charges only, post standard charges with additional pricing information, other, or don't know yet. And again, that question is, how are you planning to address the new CMS price transparency mandate by January 1st? Post standard charges only, post standard charges with additional pricing information, other, or don't know yet.
And Brad, as we're waiting on the poll questions to finish up, there was one other question that did come in. The previous couple of slides, we referenced a case study, and there was a question referencing, do we have a case study available? And we do, and we will send that case study out to all of the participants today related to what Catholic Medical Center has done and their process of making adjustments in holding net revenue neutral.
Sounds good. And it looks like most people have voted, so we'll go ahead and close that poll out and continue on with the presentation. So now that we've gone through how to properly adjust charges, we can look at how to best present this pricing information to the patient online. So we know that the digital expectations of consumers are rapidly changing. From another recent webinar we hosted, we learned that there is a very large gap between online consumer expectations and what healthcare providers are offering today. So for example, 47% of consumers now actually expect personalized service. However, only 7% of healthcare providers that we surveyed were currently offering personalized patient estimates on their website. So that's really an expectation that we as an entire healthcare industry needs to start embracing. And I also mentioned earlier that 36% of patients have used the internet or mobile apps during the past year to compare the quality and cost of medical services. Another interesting statistic to add on to that is that 1 in 10 patients said that they would actually switch healthcare providers after price shopping. So let's put this into perspective. Let's say you average 100,000 patient visits a year, and if we assume that 36% of those are price shopping, that's 36,000 patients. And of those 36,000, 10% could go elsewhere. So that means you could potentially lose 3,600 patients to price shopping alone. And that's the bottom line impact that we need to start taking seriously. So what do consumers want from their healthcare providers? Well, they used to just want to know, will I get better and how much will this cost? But now they want to know, how much will this cost me? Not only that, they want to know if they're getting a good deal. That's why 36% are now price shopping. What am I going to pay for an MRI at your hospital versus the competition in your local market? And then finally, how do I get this without a hassle? You only have about 8 seconds now to capture the consumer's attention online. If you don't, they will get frustrated and simply move on, potentially to a competitor. So now let's look at an example of how to meet these new consumer demands. And keep in mind the points we just talked about and how this example addresses those points. So first and foremost, we need to capture the patient's demographics. And we need to make it convenient for them. So in this example, notice the option here that we have for the preferred method of contact. It's very subtle, but it puts the patient in control for how they want to be contacted, and it reinforces that point about personalization I made earlier. Next up is the patient's insurance information, which is one of the key factors to providing an accurate estimate for the patient. We can now select a service and even compare multiple services. Personally, my favorite aspect of this example is that as a patient, I can compare prices across different facilities so that I can choose the best price based on my location. Again, it's personalized for me as the patient. If I'm especially price conscious, I might choose to drive a little further to save some money. And for any health systems on the call today, this is definitely a key consideration as you're considering patient estimates online. So in the estimate we just looked at, notice that we were given an exact amount and not just a general price range. When we book flights or hotels, we don't want a range. We want to know the exact dollar amount we're going to have to pay today. And the same goes for healthcare. So it's important to remember the data points that drive the accuracy to arrive at that exact dollar amount. When you're providing estimates to your patients, it's important to remember these 4 factors: selecting the right service, selecting the right location, selecting the right insurance coverage and benefit information, and then having the ability to calculate the contractual allowable amount. So keeping everything in mind that we've talked about today, how do you bring this all together with the January 1st deadline looming? And how do you guide your patients to what's not only best for them, but also best for your organization? So this is a conceptual model of how we can guide our patients and how you can control the price message. So let's look at the messaging here just to start out. It's very simple. Know the cost of your healthcare. You can see in the subheader here, we mentioned that CMS is requiring us to publish standard charges, but that doesn't accurately reflect what it will cost the patient out of pocket. At the top of the page, which we in marketing call above the fold, we try to guide the patient to the most important information with a clear call to action. Get your estimate now. That's what's most important for the patient. Now, if the patient chooses to not get an estimate now, that's okay. Now, if they were to scroll down the page, they can now see how your hospital compares to the local market. This isn't the most relevant information for them, but it still educates them about charges and at least gives them some context about how your hospital compares to the local market. Notice, however, we're still attempting to guide them toward an estimate. So let's get back to the CMS rule. We can still provide that list of standard charges that CMS requires, but notice how we've placed it at the bottom of the page. This is because we don't really want patients to go here because it's really not the most helpful or relevant information to them. You can see here that we are still trying to guide them to get an estimate. So notice that we've tried to guide the patient now 4 different times on this one web page to get an estimate, and we only link to the list of standard charges once. As long as you link out to the list of charges in a machine-readable format that CMS has outlined, you will have successfully met the requirement. So the bottom line and the big takeaway here is that you have to post standard charges no matter what. Everyone on this call will be doing that on or before January 1st. We just believe there is a better way to educate your patients, and we want you as the healthcare provider to control the pricing narrative and not CMS. So with that, we'd like to take any final questions we have from the audience. So I had a question come in, Greg. What's the best way for our hospital to present patient estimates on our website? So what I would say to that is that the example we outlined is definitely a conceptual model, and ultimately it's up to your hospital how you want to present pricing information and what's most important to your patients and your demographics. But there are 3 critical factors that we think should be included with any patient estimate. And you need to have the ability to do these 3 things, and that's to select the right service, select the right location, and have the ability for the patient to select the right insurance coverage and benefit information to drive that accurate estimate for the patient.
Great. And it looks like, Brad, we've got one other response. They noted, and thank you, Sarah. They noted in response to the first question related specifically to Epic and the pharmacy and supply component, Sarah wanted to pass along that Epic has developed a recommended solution for this requirement, and they have a guide available that walks providers through the specific steps to export the CDM-related extracts. So you probably should reach out either to your IT department for that information or reach out directly to Epic for that insight. We also had another question related to when CMS cites all charges, does that mean a rehab outpatient charge if it's a separate location? And the answer would be in the affirmative that yes, you would need to list all charges. So if you do have a separate location that is a part of the hospital, a freestanding outpatient center, HOPD location, you would want to list and include those charges as well.
So another kind of tactical question here, Greg, about posting charges. So when CMS cites all charges, does that mean rehab outpatient charges if it's a separate location?
Yes, we want to include that as well. Yeah.
Yeah, so I think we've got a lot of good questions here today, and some of them tactical relating to the rule. But I think the big takeaway here, Greg, is that everybody will have to adhere to this mandate by January 1st, but it really goes beyond just posting that standard charge master. It's really important to think ahead and have a strategy and think about what the implications are for just posting your standard charges, and really think about what's most meaningful and relevant for your patients.
Couldn't agree more, Brad. I think everyone needs to be prepared over the next few weeks to address the tactical step, and that's posting your CDM file. But bigger picture, you're absolutely correct. We do need to be looking as an industry and as organizations, how do we come up with a strategy that really addresses the critical piece of not just charge transparency, but really price transparency, and ensuring that we're providing to patients, our consumers, what they're looking for. And that's how much something's going to cost me as an individual. I think it's going to be the relevant piece that we're all going to have to be very focused on, very diligent as we move into 2019.
Well, with that, we'd like to thank everyone for attending. And if you do have any follow-up questions for either myself or Greg, contact information is provided here, and we'll be sending out a copy of the slides and recording of the presentation to you within the next day or so.
And we will be including the poll question results as well as part of that feedback.